Good evening, guys. Today we will discuss about a very important topic, which is the risk assessment models in breast cancer. So I have put this page up. This is a page from my notes. I've put this page up to just show you that we all know that these are the risk factors for developing breast cancer. This is a very common question which is asked in both MCQ exams as well as the Viva, and even in your even when you practice, you should and you must know these things, without which it will be absolutely a blunder, right? So these are all the risk factors which we all know, which are responsible for developing breast cancer in any woman, right? Now it's a and it's a common sense to know that the more the number of risk factor a person holds, the more the chances of that person developing breast cancer, right? It's not rocket science to understand this thing. Then why do we need any sort of risk assessment tool or a risk assessment model? What is the need for it? So we should first understand that it's not just we can't, when a patient comes to us and says that my mother or my sister is known case of uh, BRCA mutation. Now tell me, doctor, should I get a genetic testing for BRCA mutation? What is my chances of developing breast cancer in the future, right? Or suppose another patient comes to you and asks, there are like 2-3 people in my family who have had breast cancer. Tell me, doctor, and I am planning for pregnancy. Tell me, doctor, should I get any medications that can help me not develop breast cancer in my future? So you should be able to answer these questions in a very evidence based format, and not just randomly beat around the bush and saying that you definitely, because you have so many family members having breast cancer, you definitely have high risk of developing cancer. Correct? That is why we have so many trials and studies that have happened, and so many models have been used, like Gale model, Claus model, Bracapro model, Tyre-Cuzick model, Boadicea model. These are the most commonly asked models, also most commonly used. There are many more, but then it's impossible to remember each one of them, right? So the main purpose of these models is to tell us, or is to help us tell our patients if they need chemo prevention or not, if they need genetic counseling or not, or as in genetic counseling and genetic testing, and instead of regular mammography, should they also include MRI in their screening? So these are the three main answers that will be answered, but these are the three main questions that will be answered by these models, right? Now it's impossible to remember all these factors individually, especially for those students who are preparing for NEET PG, where you will have to study 19 plus subjects. Even for people who are in their NEET SS preparation, it's impossible to keep in memory all of these uh, factors. Also, there is no need, even in your practical life, there is no need to remember all of these things, because these are all online tools, these are all online models where there will be so many questions asked online. You have to just tick yes or no, and then the risk will be calculated on an online basis, right? So there is no need to manually remember any of these things. But then it's a irony that they ask these questions in the multiple choice questions, and then for such situations, though even if we cannot remember everything, we can at least try and rule out certain things if we keep in memory certain common things or certain unique features of these models. So that is what I am trying to help you guys here. So first let us see the Gale model. Now, one thing that everybody can see from what I have highlighted here, that is the age of the person. Age of the person is a common risk factor that has been included in all of these models, which tells us how important role age plays in developing breast cancer. As the age increases, the risk of breast cancer also increases. Now coming to the Gale model. Now Gale model is the most common model that is used to see if the patient will benefit from chemo prevention or not. That is why there is no way you can forget this Gale model, and if you can remember this one model, it will be easy to compare and keep in memory the other models also, and this is very simple to remember. So the one model that we can remember is the Gale model. So first one, the first factor that is the risk factor that it includes is the age of the person. Second is the age at menarche, age at first live birth, and the breast biopsies and the family history. Now take a look at all these models. Just for comparison sake, I have put all these side by side so that it becomes easier to remember. The family history that is used in Gale model is the family history of first degree relatives only, while coming to the Claus model, it's a slightly modified version of Gale model only, wherein all the first three factors are similar, just that the breast biopsies are removed, and instead of that, the family history, they have added second degree relatives also. Correct? Now in Bracapro model, they have considered the family history very extensively, wherein the family history of first degree relative is included, second degree relative, third degree relative is also included, along with which not just family history of breast cancer but also bilaterality, male breast cancer and ovarian cancer are also included. So you can understand how extensively the family history is studied in this Bracapro model, right? So is the situation in Boadicea model as well. Okay, now by looking at these two things, what is the one thing that we can understand is that Bracapro model and the Boadicea model, they give importance to the family histories, because of which we can use this to estimate the risk of the person carrying BRCA1 or BRCA2 mutation, right? Now coming to this Tyrer-Cuzick model, just like its name, the number of factors it considers are also so very extensive, very difficult to memorize or keep in memory. But one thing that we can see is the family history is as extensive as we saw in Bracapro or Boadicea model, along with which the personal history is also very extensive here. The personal history, like person's body mass index, that is, we are testing the person's weight or obesity as a risk factor, and age at menarche, first live birth, हार्मोन रिप्लेसमेंट यूज्ड और नॉट, प्रीवियस ब्रेस्ट बायोप्सीज में क्या आया था, ADH और LCIS, all these things are included, right? Now so though we cannot memorize each and everything in this, we can at least keep in mind what is common or what is that special thing that is included, right? One common thing is the age of the person that is seen in every model, and the family history, how it differs in each model, that we can remember, and what is that this model used for most frequently is that something that we have to remember. Like Gale model, it is used to test if the patient will benefit from chemo prevention or not, Bracapro model and Boydacia model we are using to see if the patient has got BRCA1 or BRCA2 mutation or not. And because this is such an extensive or cumbersome model, this will estimate the risk of patient having both BRCA1, BRCA2, if they will benefit from MRI screening and along with the regular mammogram screening, and also it will help us test if the patient will benefit from chemo prevention or not. Right now, one more thing that that must be remembered is the criteria in case of Gale model, because Gale model is something that is very popular and used very frequently. It would be advisable to remember this number, which is Gale model is definitely an online tool. You put in all the risk factors of the patient and then you press enter. It will give you one particular score. If that score is more than or equal to 1.66, then it means that that patient will benefit from chemo prevention using tamoxifen or raloxifene. Okay. Now, yeah, these are this is something that I have written, just what I told you all, guys. Right now, if you remember this much, you will be able to answer most of the questions that most of the possible questions that might come up from this topic. Like for example, suppose they ask you which is that one model that is used for testing if the patient will help from chemo prevention or not. Like I told, the most commonly used model, that is the Gale model, but at the same time the most extensive model which includes almost everything, right? Almost I'll just clear this off, otherwise it becomes very messy, right? Just give me 2 minutes, I'll just clear this off. Okay, so because this Tyrer-Cuzick model is something that is very extensive and uses almost all the risk factors that are responsible for breast cancer, this is also something that helps us decide if a person will develop benefit from chemo prevention or not. Now, second thing, which is the only model that will predict the risk of developing in situ carcinoma, be it ductal carcinoma in situ or lobular carcinoma in situ. Suppose such a question has come up in your NEET SS or NEET PG exam, and they have given 4 options like Gale model, Claus model, Tyrer-Cuzick model, and some Bracapro model, and you do not know anything about it, but you just have remembered one thing, that Tyrer-Cuzick model is a very extensive model, and hence it can predict the help us predicting 3 things. One is the benefit from chemo prevention, second one is benefit from regular MRI screening along with mammogram screening, and the benefit or the need for genetic testing or genetic counseling. So, one thing that we all know is this is an extensive thing that will help us predict so many things. Okay. So, one thing that you can guess is that because this is an extensive model, it might also help us predict DCIS or LCIS. So, definitely see here in this table, you can see that this is one model that takes into consideration the breast biopsies, like which includes lobular carcinoma in situ or the ductal carcinoma in situ also. Now, and you have to keep in mind that all the other models, Gale model, Claus model, be it any other model, they all predict the risk of developing invasive carcinoma and not the in situ carcinomas. Okay. Now, which is that other questions, like what another question that might be asked is the which will help us predict if the patient will benefit from MRI screening or not. Definitely the Tyrer-Cruikshank model, right? Um, so that is the only way of remembering these models. That is, you have to see which is the common factor and what is the special factor that is included in each of them. The Gale model has got a very poor family history. It takes into consideration the family history of first degree relatives only, while Claus model is a slightly better version which takes into consideration second degree relatives also, but then there are better, but if you have to really look into the family history extensively, there are better options like Bergkapro model and the Boadicea model, which have got extensive review of the family histories. But if you want family history as well as the personal history, then Tyrer-Cruikshank model is the best. Thank you.